Of this function, Mrs. Dr. Soumya, guest of honor, Dr. Ezhilan, my friends, Dr. Nagi Reddy, all faculty, national, international, delegates, friends. I'm delighted to stand before you to welcome all of you to this wonderful international conference workshop in the SCOPE2025 at this hotel ITC, Chennai. And today, for this August function, we have our chief guest, Soumya, who is internationally well known, and her father, Dr. Swaminathan, all know, the researcher, scientist who made a great revolution in India, Bharat Ratna. Now, his daughter, Soumya, is again work during COVID time at the international level, which is great, inspire good researcher, support of medical. I welcome Madam for this wonderful guest accepted. I know you have got a commitment to go to Delhi. In spite of this, when you approach any time that you are accepted, this is great love appreciation towards us. Thank you very much. She is to support for PhD research program, our own colleagues management. And today we have our friend Dr. MLA of Chennai, and always with us. Anytime you approach, he is always to support us for this. Very happy. Thank you. Welcome. And my friend Nagi Reddy, all know, you have listened to you. Such a great friend and promoter of endoscopy society. And today he is going to reveal Lifetime Achievement Award. I'm very happy about it. And today I am very proud to say he is to my knowledge, only one to receive. It's not Padma Vibushan, it is beyond Padma Vibushan and received recently from congratulations and well wishes. You are always motivated for all scientists. And question was asked, are you jealous anybody is there? Probably I may be jealous of you, the way you admire this. I am very welcome, accepted to be here. And the International Federation giving a talk. Such a wonderful talks. Really admiration. All young people, delegates participate. The companies necessarily none of the people are coming out to listen because they are so wonderful. Everyone of them is speaking. No company is and appreciation. Thank you both international and national to be in us 2 days building all of you. And thank you very much. I welcome all of you. And more than that interest learning minimally invasive. And youngsters participating as delegates, I welcome all of them. Very happy about it. And the press and friends, and without their support, and nothing can become more. Dr. Kalam was president of India. He told me, doctors, medical or surgical, whatever we innovate, until people become aware, that is not going to reach. That way, there is people helping us to do get into the company. Very happy. Welcome all of us people here. This is as I said, big problem. Yeah, I don't know many of you know. It is a gastroenterology medical center, a dedicated gastroenterology practice. The subject which we know want to serve the community. That's why 2000 we established GEM Hospital, Coimbatore first time. Then subsequently, of course, we have a chain of hospital in Chennai. We have seen that the last 2 days, even the day before also, we had a training course there. Everybody appreciated training course. They can do hands-on program in the days. They are very happy coming and telling me, sir, we learn, very happy about it. So this is a dedicated center. When we started at that time, people also said, single subject you are starting, don't want to take risk. Why not you go? We are not business people, we are a science promoter, gastroenterology science. So nothing, we don't worry about money and what we know we teach, we serve the community, what we can innovate, we innovate, and ultimately be part of the society. So we love the people, be part of the people. That way, GEM Hospital stand with this. And equally, when we started that time, not much center, only Nagi Reddy, Hyderabad, and a few of them here and there. Now, because of Nagi Reddy, because of teachers, many of the people today across India, even at non-local level, people are practicing so high quality, very, very amazing. But today, the discussion going on, the concept, one side the talking surgeon means open surgery. That is all gone. No, if we talk about healthy surgery, it has to be minimally invasive surgery. Again, if we talk about interventional, it has to be focused. So here, marriage happening between the interventional radiologist, physician, and surgeon coming together, it become a new specialty now. That is where we can do much more. That's what last 2 days you all listened to it. So today, unfortunately, I could not talk interface between emerging it. So today, hereafter, surgery means minimally invasive surgery, and minimally invasive therapy is a correct word to use. Physician and surgeon can come together to work for, and we can have consensus what to do the best. Ultimately, the patient is worshipping. That's why I always take a folded hand in front of every patient before deciding a treatment protocol, because so many things will happen. But patient should receive the best care of it. That way, this conference from my heart, I am saying, very successful because of the faculty, because of the delegate participation, interaction. So I'm very happy about it. Indian surgeons finding a lot of difficult and doctors finding difficult because of strategy. You look at our system in India is something not like Western countries. Although there are colleges, medical government, like an institution like AIMS, lot of things, in spite of this, every doctor, physician, surgeon, they try to do the best for the community. And lot of innovation have come from India as well in Western countries. That way, I started and given, and minimal investment on surgeries today we have to promote well. And still in India, it is not happening in the Western countries. You go to Korea, you go to Japan, Taiwan, the highest percentage of cancer today taken by minimal invasive, like laparoscopic robotic. Japanese government pays 50 to 100% remuneration more insurance because patient gets the benefit. So that means we have to push a little more in complex surgeries and particularly the minimal invasive way. All of us learning about it. And this is the first SCOPE program, and I congratulate my own team that and the entire team taking a last few months and great effort have taken inviting all. And in spite of short notice of international faculties come all the way from different countries, states, and Japan, and everything. I'm thankful to all of you, appreciate your invested towards us. And this scope is truly a good scope for India, and we definitely, in this part of the country, we work continuously to do the best care. And this take opportunity to thank everyone on the field with folded hand. Any shortcomings, and always this happens, part of it, not why intentionally we try to do. Our hospitality people organize, everybody wanted to do help, and be part of informal and be with us. Thank you very much. Welcome all of you.
So many inspiring people, both on the dais and also in the audience. And I enjoyed the previous session, like I'm sure all of you did, where we heard from some of the stalwarts in gastroendoscopy, but talking about different aspects of their lives, their successes, their failures, people who inspired them, and also some words of wisdom. So I'm not going to talk about endoscopy because I'm sure everyone in this room knows more about it than I do. But I just wanted to say a few things about research, about innovation, and also some lessons that I learned, during COVID when I was the chief scientist at the World Health Organization. So from a young age, I was always interested in research. Maybe that was the environment in which I grew up. But I wanted to be a neuroscientist or a actually a scientist going into human genetics. But as it turned out, I then ended up going to medical school. That was not my first preference. But even after going through medical school, I continued to remain absolutely committed to a research career. And I must say that when I came out of medical school, or even during my years there, no one talked about research, about medical or health research. None of my faculty members, teachers, professors, in fact, they were all extremely disappointed and said that, I should have had a brilliant career in clinical, and why did I want to go into pure research? It was when I went to the US to do a fellowship after my MD that I really got inspired by some of the mentors at the University of Southern California in Los Angeles at the Children's Hospital, where I learned what research methods is all about, how to ask the right questions, how to design your, and it was all clinical research, mind you. It was not basic lab research. I was also very clear. I didn't want to be in a lab and I did not want to be in an animal facility experimenting on animals. I wanted to do clinical research on clinical problems, day-to-day clinical problems. And so I did my fellowship in pediatric pulmonology, and then when I came back to India, again I was very committed to working in India. So I spent 3 years abroad and came back, and again everyone I met told me that I should get into clinical medicine. But of course, at that time the subspecialties were hardly known. So pediatric pulmonology was not really anything anyone was aware of. But still, we had a huge burden of asthma, of many other lung diseases in children. And the other thing was I could not find a job where I could do some clinical practice, research and teaching. So things have changed, of course, since then. And what I see today is that there's a lot more research happening. In fact, outside the government system as well as within the government system. And some of the best research that's come out of India in health, I think, has been in private settings or in NGO settings, in rural areas, tribal areas. So I think that the lesson is you don't need high tech, you don't need big, huge labs or facilities to do high quality research. You need good powers of observation. You need a deep interest in improving the situation that you see, and that's what we heard, I think, from our innovators today, that they found a problem, they wanted to tackle it, they wanted to make things better for the patient. So I think research is all about making things better and improving on what you found it earlier. And so this is why everybody must and can do some research wherever you are, because really the goal is to use your experience, wisdom, and the clinical material that we have in India. I think it is unparalleled. We will not get this anywhere else in the world. The numbers of patients, any condition, any disease, just because we are a population of 1.4 billion people, you can have the largest case series in the world. I think our challenge is putting together good clinical observations, keeping records, having cohorts and longitudinal follow-ups, and then being able to analyze that data. If you have lab biomarkers, pathology, scans, that adds, of course. And so when I was in the ICMR, we really expanded our investments, and ICMR continues to expand investments in centers of excellence. Both now they've opened up to private places as well. It used to be restricted to government, but now they have a scheme where you can have collaborating centers, ICMR collaborating centers or centers of excellence you can apply for. Some of them are funded, some are unfunded, but you get that. Just like WHO collaborating centers, you get a stamp from WHO, you get to do a lot of work, but you don't get any funding from WHO. So I think inculcating interest in research in medical schools, I think that's still a challenge for us. Whereas in the West, you have many more opportunities to undertake research when you're in, starting from school, but then you go into college, medical school, etc. So we need many more mentors like we have today over here, and people who you can look up to, the youngsters can look up to, who are very busy clinical practice and yet have found time to do some path-breaking research as well as innovation, in equipments and in devices and things. The second area is around collaboration. So during COVID, what I noticed was that there were a lot of things that were terrible during COVID. I think we had experienced a huge amount of pain and fear and loss. But what stands out is the fact that we were able to find a solution. We were able to find a vaccine in less than a year, which has never been happened. It's unprecedented.
The world. Why do I tell you as cave jumpers is? Here I stand as a practicing physician as well as a people representative. During my intern days in Madras Medical College, I used to go for my medical gastroenterology postings. One thing used to really provoke my curiosity is Our endoscopist or medical gastroenterologist maneuvers inside the cave of the alimentary canal. The great adventurist, the various adventures you undertake for the every journey you take for each and every patient is unmountable. Sometimes the cave is bloody, the cave is aggressive, catching a feeding artery, identifying the culprit lesion, taking a tissue biopsy. Thanks, my friends. You've been really good help for our practicing physicians to make a diagnosis. Welcome to Chennai to the external world delegates. You're in the right place because Chennai is the cusp area of both East and West practices, or the best medical practices of the entire world summating at one point. I congratulate the Society of Gastroenterologists and GEM Hospital to organize such a big conference for summation of various ideas between the East and the West at one point, that too in Chennai. We come from a unique state when compared to the rest of the country because our health system has been the best model to emulate for any developing nations. Many international epidemiological reports, anthropological reports, or medical human resources are favored Tamil Nadu model of health delivery system. Here we have a excellent proposition given to the world, especially in developing nations, where generations and generations of education has been limited only to elites. So Tamil Nadu is the foremost state who broke the elitism in medical fraternity. And I stand here as a proud person belonging to this health system, where we reached a concept of reaching healthcare to the commoner. What the solution is to make the commoner as medical doctors. We have the special affirmative action in our public health system, public health education, so that we have representations from all type of spectra, first generation doctors, socio-economic backgrounds, as endoscopists, medical gastroenterologists. Attending an international conference of this kind is unique proposition when compared to the rest of the country. It takes at least for a simple consultation or OP consultation in various Western countries, we did a study about what is the time taken for each and every patient to see a physician. In US, it takes 20 days. In Italy, it takes 10 days. In Arab nations, it takes 10 days. In Spain, it takes 9 days. In Sweden, it takes 7 days. In France, it takes 6 days. In Germany and Australia, it takes 4 days. But for me, at the night time in my clinic, if I see an 8 o'clock patient, I can do an endoscopy the next day morning. That's the ecosystem we have developed in our Tamil Nadu. I congratulate the organizers to have a brainstorming sessions in this particular area. I would concur or align with Soumya ma'am, who gave us a brief picture about the research ecosystem of our particular country. The problem is, in a vast country like us, a pluralistic country like us, I think our research modules and healthcare should be decentralized. We should have a decentralized approach. A union or a center can give a framework of general guidelines. But all these regulation issues which were discussed in the previous session, it can't be a single point or a center point. So it has to be diversified and decentralized. So a state like Tamil Nadu, which has been doing a pioneering work in tertiary care health system, can have their own mechanism of an R&D regulatory system with guidelines received from the center. So each time, for each approach, the journey taken for a research paper from an hospital to a state to a unit with this many kilometers above us, and the regulation and understanding the research milieu, the time gap being delayed is a curse to our system.